Subscribe to our YouTube channel and press the bell icon to get the latest updates.
Today's webinar is on the future of healthcare, and we have with us Mr. Gaurav Malhotra, a Wharton alumni. He is a managing partner and the founder of Ekesia Advisory. He has 25 years of rich experience in healthcare domain, in leading business and change management across MNCs, startups, joint ventures, and re-engineering organizations. He was the managing director of Medicover, a leading European healthcare group. He was earlier MD and CEO of Vaughan Hall International, MD and CEO of Patni Healthcare Limited, founder and CEO of Medford Hospital, business head Asia for Bosch and Long, and business director for Johnson Johnson Medical. Thank you, Mr. Malhotra, for your time today. Now I'll leave the floor open to you for your keynote. You're muted, sir.
Sorry. Good evening, everyone. I appreciate your valuable time and hope and pray that you and your loved ones are safe and healthy. Before proceeding with this session, I would like to thank our COVID warriors for their extraordinary efforts during these uncertain times. This pandemic has been an eye-opener and has reinstated that health is the basis of wealth. In a post-coronavirus, healthcare would emerge as a major focal point of attention for many nations across the world. In most geographies, the basic structure of healthcare system has only marginally changed since World War II. The COVID-19 crisis, in my opinion, highlights the need to determine how to meet a rapid surge in patient volume while managing seamlessly across in-person and virtual care. Coming out of this crisis, I think most of you will agree, the relationship between government, businesses, and individuals will be reshuffled in a fundamental way, especially in the context of health and wellness. Healthcare leaders need to anticipate these changes to policies and regulations as society seeks to avoid, mitigate, and preempt a future healthcare crisis. Reimagining a healthcare system and services will require the imagination of many. This crisis has revealed not just vulnerabilities in our system, but also transformative opportunities to improve healthcare. During this crisis, leaders have had to re-examine their understanding of how and where care can be provided, of how and where professional boundaries are truly fixed versus flexible, of which costs are truly fixed versus variable, which resources are nice to have versus required. I think in my 27 years of experience in healthcare, we haven't seen such a transformation. This pandemic is likely to result in a series of discontinuous changes that will fundamentally reshape healthcare. These changes will include the expectation and needs of individuals as citizens, consumers, and employees. The combination of resilience and productivity demanded by the investors of healthcare expenditure, which is very important. The need to be able to flex up and down care capacity and shift across modalities, including virtual health platforms. We have seen it, I think all of us have seen this very clearly in the recent times. An opportunity to unlock the promise of exponential improvement through technology and medical science. We have identified some of the future trends expected in healthcare. Number one being healthcare post-COVID-19 will not and should not be the same. We don't have to make a case for investing in health. And we all know that in our country, as a percentage of GDP, we had not invested in healthcare over a very long period of time. And there are many other countries across the globe. Now every country has learned the hard lesson that pandemics can destroy the global economy and cost trillions. Investing in health is investing in the economy. We will see a renewed attention to and repositioning of health on the political agenda. This is the first time when we are seeing politicians will be asking votes basis on whatever work now they will do in the field of healthcare. And I think this is very important and very, very critical, and this is a major change. As people become more clearly aware of the role of government in health, and as governments will have a hard time reversing the positive measure they have put in place to respond to COVID-19, I think we will see a major structural changes. And we will also see a lot of investment coming from government in healthcare. Point number two, everyone in the world now understands that their health and sheer life can be put at risk by things far on the other side of the globe. I don't think any one of us knew where Wuhan was. At least I never knew where Wuhan was. And now we all across the globe, whether you are in New Zealand, whether you are in New York, whether you are in Bihar in India, you are in Pakistan, everywhere people have got impacted. The pandemic which started in a town called Wuhan in China. And now this has spread across the globe. So health interdependence will be the new normal. We are all living in a highly interconnected world, and this will force governments to reflect and come out with SOPs that need to be implemented to prevent the spread of the future similar pandemics. The third point, which I believe, is we will see an evolution of radically more resilient, transparent, and efficient supply chains, since there can be seen significant challenges in dynamically adjusting to demand or supply shocks. Existing healthcare supply chains failed to adequately respond to the world surge in need for critical medical supplies. There is a dire need to redefine models that enable scalable, agile production, and optimized distribution based on both actual and anticipated needs. Alternative suppliers are being leveraged today, but I think this is not yet fundamental supply chain reimagination. A lot of work needs to be done. Future steps could include governments rewarding producers for being able to scale up production of critical inputs to patient care in a time of crisis. Providers and governments maintaining greater minimum level of important items, like we saw that ventilators were not available in sufficient quantity, the protective equipments were not available, masks were not there, sanitizers were not there. And I think the initial lockdown that we had seen was mainly to ensure that we have sufficient quantity of these products to be made available for the patients, as well as requirements to build intentional redundancy into supply sources to reduce concentration in any one geography. I think across the globe, most of the countries were dependent on China, and we still are dependent on China. Whether we are talking about pharmaceutical, whether we are talking about medical equipments, and many other similar range of products. Now, I think most of the countries will start reflecting and thinking, how can they become self-reliant? Strategic reserve of supplies and agile manufacturing will be the key to success in the new normal. And we will see this accelerating very fast. We will see that shift happening. The developed nations will try to avoid embarrassing situations, like where the president of one of the strongest economies in the world had to call up the prime minister of a developing nation and request for chloroquine. I don't think he will be very happy to repeat it again. Most of the countries across the globe will try and be self-sufficient and not depend on any other country as far as critical medical supplies are concerned. Fourth point which comes to my mind, telehealth, I think, has helped expand access to care in this critical time when the pandemic has severely restricted patients' ability to see their doctors. COVID-19 has caused a massive acceleration in the use of telehealth. The potential impact is improved convenience and access to care, better patient outcomes, and a more efficient healthcare system. The COVID-19 pandemic is pushing against many of the structural barriers that had previously slowed health system investment in integrated virtual health applications, including funding mechanisms, consumer adoption, and most importantly, the provider adoption. There was a lot of resistance, and we all know about it. We as consumers were not willing to use telehealth as one of the options. And similarly, providers, doctors, clinicians were also not convinced. But I think now when we don't have any option, telehealth has emerged as a very viable option and is addressing a major need for our society. Point number 5, according to me, another emerging trend is co-optation, which is collaboration among competitors to find a solution. We would have never thought that two major pharmaceutical giants like Glaxo and Sanofi are working together towards vaccine development to fight this pandemic. So there will be many such examples which will emerge where companies will collaborate and they will try to leverage each other's resources. We would also see rapid adoption of technological advancements, which would include artificial intelligence-based diagnostics, cloud-based storage of medical records, and integration of information across the care continuum in and outside of hospitals. Now, this was an area where there were a lot of gaps, and I think we all will accept it, but things will change. Digitalization is the future in healthcare. Digital tools to facilitate remote communication between providers and patients will continue to be developed and improved in conjunction with point of care devices. Because if we don't have effective and efficient point of care devices and home-based monitoring devices, then I think it will not work. Additionally, real-time data can create effective use of supplies and allow staff to work efficiently. My other point will be most healthcare organizations have found that decisions that took weeks or months are now being taken in a matter of a days. So this is very important, I think, because in healthcare organizations, particularly healthcare delivery hospitals, decisions are very slow and there is a lot of bureaucracy, there is a lot of red tapeism. But this pandemic has clearly ensured that decisions, the speed of execution is very fast and the speed of decision making is quite fast because we have to save lives. So cross-organizational collaboration has become easier. So all that ego barriers, I think, has fallen down for the benefit of the patient. Stakeholders have benefited from the clarity of focus. Now distilling this learning from the crisis to permanently adopt new ways of working will be important. This positive change, in my opinion, will continue. Cross-organization collaboration in healthcare should continue, and the scale of change unleashed by the crisis will permanently embed speed of decision making and execution, which again is a transformational change. Next point, we all have seen that healthcare productivity remains restricted by shortages of appropriately trained clinical staff and the continued prevalence of inefficient and highly manual activities. See, when there was no pandemic, no such crisis, I think things were working fine. But now it is imperative to improve efficiency by giving non-clinical staff the capabilities to take on basic but critical activities and unlock clinician capacity for more advanced functions. When we have such shortage of critical care specialists, the ICU doctors and the other important staff, We can't be asking them to do all the non-clinical administrative work. So I think it is very important that moving forward also this will continue, and this should continue. The crisis has also shown us that the demand for services in many specialties declined. We all know that the elective surgeries were not happening, so many specialties demand was not there. But the overall demand for clinicians increased, and ability to redeploy across specialties has been an opportunity. So I think this is a very important trend which healthcare organizations and government will be working very closely once this pandemic crisis is over, and ensuring that we get adequate capacity in place. Now, this pandemic has clearly demonstrated that the capacity remains a global constraint. Now, for particularly the hospitals, all the major beds, if we see Delhi, if we see Mumbai, the other metropolitan towns, all the beds are getting full. Now, one of the main reason is the way we have built these institutions, the way we have built these hospitals. We cannot provide an isolated facility in most of these hospitals. So we have to dedicate the whole hospitals to COVID-19. Now, there is an opportunity to redesign the healthcare system by redefining the boundaries of traditional care settings to enable flexibility across sites of care. Facilities should be able to dynamically scale up or scale down capacity at different acuity levels to respond to the changing needs. This was one of the major gaps that we have seen in current crisis. And I think moving forward, a lot of healthcare organizations have started working on it. To facilitate this rapid scaling, health systems should pre-identify alternative sites of care with clear protocols, partnerships, and tiers of escalation to respond rapidly in times of crisis. For example, the healthcare and hospitality industry are currently collaborating in this crisis and trying to save lives by increasing access of care. We all know that most of the five-star hotels like Taj, Radisson are collaborating with hospitals in helping to resolve the current challenge of shortage of beds and spread of infection. In future, this will happen by design and not by default, by using the Draconian Epidemic Act. So in my opinion, moving forward, this should happen by design. The heightened expectation of financial protection, I think, is again a very important point. All the stakeholders, patients, payers, and providers are very much concerned about the financial burden that this pandemic has brought upon them. Now, we will see a further acceleration and price regulation might be enforced. We will see increased pressure to bring regulator to ensure affordability, quality care delivered by private healthcare providers. We didn't have any regulator for very, very long time. And I don't think moving forward, we can delay it. So in my opinion, currently there is a scenario of chaos, confusion, and lack of trust amongst patients, payers, and providers. Patient and the media is alleging that hospitals are profiteering from this pandemic, whereas the hospitals are struggling to remain solvent and survive because of increased cost associated for ensuring safety of employees as well as patients. Their survival is at stake since the traditional source of income like elective surgeries or medical tourism have been negatively impacted. On the other hand, the insurance companies are complaining due to the increased reimbursements. In future, we will see a viable solution emerging to ensure that the care is not compromised due to this chaos. We have seen times in the initial stages where the care was severely compromised because there was a lot of confusion and not proper understanding between all the three stakeholders. But I think in future, this gap has been clearly observed and a lot of work will be done. We will also see a paradigm shift from curative to preventive. Unfortunately, we only spend majority of our expenses in the curative phase rather than the preventive, even though it is counterintuitive. Moving forward, we will witness increased awareness among consumers and they will start taking responsibility of their own health. We have already seen a trend of increased consumption of immunity enhancing solutions, fitness bands, focus on healthy diets, and overall wellness, comprising not only of physical, emotional, but also mental and spiritual. And this will, I think, further gain momentum in future. So this will be a paradigm shift from curative to preventive. And for those in the thick of this current battle, there is no doubt that the immediate priorities are very clear. Care for the sick and comfort those in the need. But for those of us who are not on the front lines, it is critical to start considering how the lesson of this crisis can be captured, not only to make the next crisis easier to manage, but also to ensure that the ongoing operation of our healthcare system is improved in a fundamental manner. I think in my closing remark, I think, or I at least hope, that after the pandemic, global health will be truly global. We all will realize our interconnectedness as humanity and that we are one whole. And when one part of the whole suffers, we all suffer. I hope this revitalizes our need to champion even more vigorously for equity in health for all people worldwide, regardless of gender, color, race, creed, sexual orientation, or any other sexual construct. Thank you for your patient listening, and now I am open for any questions that you might have.
Thank you, Mr. Malhotra, for that intriguing speech. We have a few questions from audience. One question is, what are some of the major gaps in healthcare you think where young startups can focus on?
So I think it's an important question. If you see right now, a lot of investors are risk averse in most of the sectors, but healthcare is one of the sector where there is a lot of focus on investment. So there are certain areas where we see the investment is happening and it will further happen in next at least 4 to 5 quarters. So first area I will say is virtual health. So this is an area where now few companies have come in and they are trying to provide solutions on the virtual health, telehealth, and these kinds of digital solutions. And this is an area where there was a lot of gap. There are few companies, but few companies cannot work for 1.3 billion population. So there is still an opportunity. Then the other opportunity is also on the some of the unique problems that we have seen. Like we need now solution for geo-tracing, the geo-tracing solution, because now we have to quarantine the population, and this pandemics till the vaccine is found, you have no other solution but to keep on having those lockdowns of at least a few areas. So contact tracing, the geo tracing, these kind of solutions are important. We have also seen the use of drones, and in fact one of the companies where we had invested is playing a very important role and they are actually using drones to do the mass screening with the thermal cameras and thermal scans. They are doing the mass screening. So that is again an area that is coming up. Then if there are companies which can work on providing cost-effective solution on ventilators, which are now required, and it will be required for some time in the near future. And there are certain other medical equipments which are required. And if our own innovators can work on them, I think there are massive gaps in the medical equipment space, because most of the medical equipments are being imported. And now the companies want to be self-reliant. So if we want to be self-reliant, we need to have those cost-effective solutions to be built in India itself. So I think that is again an opportunity area. And another, I think, area is like the app that we have seen, which the government also has built, the Arogya Setu app. So Arogya Setu has some drawbacks also, but similar apps, I think, will be very prevalent in coming future. There are few people who are working on them. There are few companies, and I think those areas is again area which can fill a major gap that we have. So I think healthcare is still attracting investments. Healthcare startups are still attracting a lot of investment, and we believe that moving forward, this will continue.
Thank you, sir. You mentioned about cross-cultural collaboration, cross-organizational collaboration, which is happening. So, do you believe there should be some more cross-country collaboration also, since countries are these days focusing on nationalization and onshoring production? What are your thoughts on?
So, I think this is again a very important question. Now, the thing is, see, most of the pharmaceutical APIs, the active ingredients, were being manufactured in China. All countries across the globe are dependent on China. So there is no discussion on the cross collaboration. It was all so a time came when most of the countries were actually begging China for PPE, for masks, for other equipments. So the thing is, this will change because of various geopolitical reasons. The dependency on one country will change, but the collaboration among the other countries will increase. We are already seeing very increased collaboration among Japan and India. Japan wants to set up a lot of manufacturing facilities and want to give us the technical know-how so that we can start the production in India. We have seen after a long gap, a very increased close coordination with European countries, and a lot of European countries are very interested to come and partner with Indian companies and give their technological advancements, or asking their companies to come and do the production in India. So that is again an opportunity. US, we have already seen, we are collaborating on various fronts. On the vaccine, all the countries are collaborating right now. The UK, India, Europe. India is the major country on vaccine production globally. On majority of the vaccines are being produced in India. So every other country has to be dependent on India. But fortunately, we being a democratic country and we being a country with ethos, I think we will only work for the betterment of the mankind. So there is a close collaboration which will happen, but not with the countries which are detrimental for the humanity. So we have to be very clear. There are certain countries, I don't want to name them, but everybody knows that those countries will be excluded. Rest of the countries will start close collaboration for the benefit of the mankind.
Thank you, sir. Mr. Subbarao D. Zas, can you explain, say some strategies to address the shortage of skilled healthcare workforce?
So, Subbarao, I think this is an important question because we always had a shortage of manpower, but now this shortage has been magnified, and everybody is looking at the the gap that we have. So we have to break it down into 2 or 3 aspects. So if I talk about paramedical staff, I think we all have seen that there are major gaps. If we are talking about the ICU trained nurses, there is a major shortage. If we are talking about overall nursing care, because now we have to open up hotels where the patients have to be put, we are keeping patients in banquet halls and other smaller hotels. We need nursing care, but where are the nurses? So when we have been neglecting our training and upskilling and investing on the training of these particular in healthcare, in nursing or paramedical or clinicians, we have to face the consequences. So this gap, I think, is clearly evident that the nursing and paramedical shortage we cannot survive without this important element in our healthcare industry. So I think there will be two-pronged approach. One approach is where we will have certain common population which will be trained, which most of the countries are doing. US is doing it, certain European countries are doing. The common population will be trained, and those common population in times of crisis will be used to come and help and serve, because there are many smaller jobs that the common population can do if they are trained adequately. So that certain amount of population will be created, but there will be much more emphasis on opening up of new nursing colleges, shortening that time period, improving the quality of education. Second, I think, is about the clinicians. We have clearly seen the shortage in some specialties is huge. And that shortage, I think, is impacting our delivery of care that we are giving. I think the kind of challenge that we are seeing, we can only salute our COVID warriors that in spite of shortage of the PPE, the shortage of masks, the shortage of a lot of other stuff, the manpower, still they are fighting for us and trying to save our lives. But the medical colleges were always, there was a restraint that we will not come out with some new policies, change the policies and come out with the new medical colleges. We were always fixated on that this much of land is required, this much of space is required, which is not possible in today's scenario. You can't have such large, we need to have one hospital along with it. So all those, I think, regulations will see a change. We need doctors and some particular specialties like critical care specialty. We have clearly seen there is a major shortage. I think we'll see a renewed focus. One last point I wanted to say on this training side is we will see a lot of digital training happening. The in-person training, I think wherever it is critical, we can't do away with it, will continue to happen, but we will see a lot of digital training initiatives. We were never using digital training initiatives. We were using, but on a very smaller scale. But now those will be enhanced. So a lot of startups can also look at this opportunity. And already some institutions have started providing digital training initiatives. So this is an area where if startups can focus, it's a massive, huge area because we have a very huge clinical and nursing population. And as far as the last segment of healthcare, the non-clinical, I think that again, skilling is equally important for them. But I think still the major importance will be on the nursing, paramedical, then the clinician, and then maybe the non-clinical and administrative staff.
Thank you. So, what are your thoughts on the situation of COVID in Delhi and Mumbai, where the governments have opened everything, and also on the private hospitals, how they are handling it?
So I think my opinion here is that there are few black sheeps everywhere. So in any business you will take, there will be few black sheeps and who will spoil the overall name of the industry. But let us get into the facts. We can't say that the hospitals are profiting from this pandemic, all the hospitals are profiteering. That is, I don't think is the right statement. Now, I'll give you certain facts. The major revenue of hospitals were coming from medical tourism, were coming from elective surgeries, and all of that occupancy rate has gone down. Now the occupancy rate is now only 20 to 25%. So the occupancy rate has gone down, but all the various taxes that the hospitals has to pay, the charges that the hospital has to pay on the electricity and the other charges are the same. Government has not given any relief to majority of the private hospitals. I'm not talking about the trust hospitals, but I'm talking about majority of the private hospitals. Majority of the private hospitals have to provide the cost of the protective equipment to protect their employees and to protect the patients. The challenge is that cost they have to bear. 14 days their staff has to work, and for 14 days they have to be quarantined. And when they have to be quarantined in a hotel, that cost also has to be borne by the hospital. So the other countries, if I take as a benchmark, US has taken care of the cost of the employees, and US is taking care of the cost of all these protective equipments. It is not happening right now. So the three major crises that any hospital is facing in India, a major hospital is facing in India. The first is the liquidity crisis. What we have to understand is why this liquidity crisis is happening, because most of the money of these hospitals are currently pending with the government. So they have treated CGHS patients, central government health, and they have treated a lot of similar patients. The money has never come. There is almost thousands of crore of rupees which is pending with the government, which government was supposed to release. So that has not been released. So this is a liquidity crisis. Also, because of their shortage of business, there is another crisis of solvency. Most of these hospitals, if this continues, will not be existent. So 65 to 70% of the care is being delivered by the private healthcare. And if we continue and don't support the private healthcare, then the solvency crisis is there. And the third important crisis that the hospitals are facing is sustainability. How do, once they overcome the liquidity crisis, overcome the solvency crisis, how do they sustain in the future? Because of so much of price regulation, the sustainability has become a major challenge. So I think overall, we have to look at things in the complete perspective and not make our decisions or observation based only on the media, which is the observation which is happening. Having said that, I will agree that there are few black sheeps in the healthcare industry who want to profiteer, but they should be isolated and they should be punished. But not all the hospitals should be punished. Otherwise, if we keep on doing FIRs against the institutions of centers of excellence, then how will the care being provided? This fight has been fought or is being fought by the COVID warriors, by the doctors, nurses on the front line, not by the politicians or any other bureaucrat. So we have to be very clear that we have to appreciate their efforts, and we have to ensure that private healthcare also remains solvent, also survives.
Thank you. Do you feel the investor sentiment would be positive for the healthcare sector in the future compared to other sectors?
I definitely feel from the last 3 months of my interaction with other investors, and I've been very active in the investor community. So most of the investors are looking at healthcare as the immediate investment opportunity, because we have seen that without proper health, you cannot have a good economy. So everything has come down. Everything has been now closed down. Economy is having a major damage. What is the core reason? The core reason is because we had never invested adequately on our public health infrastructure. We have not invested on basic health sanitization and basic health issues. So if you see the states which have done well, Kerala, why it is doing well? Because the public health infrastructure was in a good shape. And even the other countries which have done well, Germany has done well, New Zealand has done well, and some other countries, public health infrastructure was good. So in India, healthcare is one of the sector which needs massive investment. Our bed ratio is pathetic. Our doctor to per thousand population ratio is one of the worst. And any other ratio you take, we are one of the worst. The percentage spent of government to GDP is again one of the lowest. So massive investment is required in healthcare in various shapes, whether we are talking about the tertiary care, secondary care, and now primary healthcare. Primary healthcare will again emerge as a major center for investment. So I think overall we will see a lot of positive sentiment. We have already seen positive sentiment. We are already seeing a lot of investment happening in healthcare startups. And moving forward, we will continue to see investments coming in the healthcare space.
Thank you. Another question by Mr. Subarao. How can we approach to address the healthcare at rural areas at mandal level, especially for migrant workers?
So basically, I think one of the major challenge which we have seen in this whole pandemic is the impact on the migrant labor, which basically we all have seen that they are to travel a long distance to go back to their houses. Now the issue is about the rural infrastructure and rural health. We all know that most of the rural centers that we have, the government centers, the PHC centers, which we call primary healthcare centers, are in a very bad shape, except barring few states. I think most of the PHCs are in a very bad shape. So there has to be, now there is a plan where there is a public-private partnership which the government is proposing, that the district level has hospitals will be now, there will be a partnership with the private players, and the private players will manage those district hospitals. And under those district hospitals will be the primary healthcare centers. So in my opinion, I think that can fundamentally change the situation, because right now the doctor is missing, the nurses are missing, and then everything is left on the Anganwadi worker or the few untrained staff that we have. So there is a public-private initiative which the government is seriously thinking, and there might be soon some changes coming in. And if that happens in most of the states, the situation will change in the rural sector. Otherwise, the rural people are traveling currently 70 to 80 kilometers, and in some cases more than 100 kilometers to reach a hospital in a district. And then unfortunate thing is most of those district hospitals are not properly equipped to take care of the patients. So then they have to travel another 200 to 50 kilometers. So this is becoming a major drain on the resources of this poor community that we have, in spite of the fact that now we have a Ayushman Bharat scheme, which is a very well thought out scheme. But then there has to be proper hospitals who will deliver on that scheme. Even if they have a 5 lakh cover, there has to be proper care. Access to care has to be there. Otherwise, what will they do with that cover? So I think moving forward, those changes with public-private partnership will see a very positive change in the future.
Thank you, sir. Another question by Indrani Chakrabarti. With triple problems of insolvency, liquidity, and sustainability, do you see a sharp drop in quality of clinical and patient care going forward? Any tips for hospitals to balance cost and clinical excellence?
So I think very important question Indrani has asked. And right now, there is a battle for survival. Let me tell you very frankly, most of the hospital CEOs that we are talking to, there is a battle of survival. Most of the chains which people or media think that they are profiteering, they are making huge amount of money, most of them are running in losses. You can take last 10 years balance sheets of listed hospitals chains, and most of them have never been able to make a return on capital employed of more than 6 to 8%. which is very bad as compared to any other sector that we take. So these three challenges that we have talked about, the liquidity, government promised that they will release the liquidity. This is the hard-earned money of those hospital sector itself. And but that money has not been released. So that is a challenge, which is an immediate challenge. And the more debt hospitals are taking to overcome this challenge, again, they are getting into a debt trap. Then the second about remaining solvent, I think we will see major consolidation in this space. The good hospitals or investors might take up the smaller hospitals because there is a major setback to the smaller hospitals, which were mainly focused on elective surgeries. So those smaller hospitals we will see a major merger and acquisition happening in this space. And sustainability will remain a concern, because now when these price regulations are coming, and these prices which we are seeing are not a realistic pricing. So if these pricing continue, then I think there will obviously be, I will not say a compromise on the clinical care, because obviously the doctors are the same, and they, in our country, I personally believe that they provide the best of the care. So they will not be, but the technological advancement, we will not see that technological advancement happening. And that will cause a lot of suffering to patients from the chronic diseases and also the serious disease. So we will not see the technological advancement coming in, because that requires huge amount of capex. And right now the investors are not willing to invest because they see an uncertain environment, and every day there are changes in decisions. So to answer Indrani's question, clinical care might not be compromised, because which is being delivered by our doctors and nurses, but the equipments, the disposable items that we have to use, the consumables, if the quality of those medical supplies is compromised, because now we have to do under a certain limit, then I think that compromise will obviously happen moving forward. Because when the sustainability of a hospital, suppose, is at 10 rupees for a daily running a proper ICU bed, and government is saying run it at 2 rupees or 3 rupees, so what will happen? You have to see a change in the care. And when we are running these private hospitals on the government rates, then we should also not expect, when we go to a government hospital, we expect a similar unhygienic environment, and there are a lot of challenges that we see. So we should not expect the best class treatment with the government rates. We have to lower down our expectation, which in the current time is reasonable, because so many people are getting infected that government also has no other option but to regulate it. But if it continues post-pandemic, the whole structure has to be rethink of, and the whole sector has to reflect and see the way forward.
Thank you. So one final question. So how far are we from hitting the peak active cases do you think we are?
So, I don't think anybody can guess it, but I'll give it a try. See, we had a lot of discussion recently with our Wharton business and Harvard alumni. We had a lot of sessions with some renowned doctors across the globe. And I think the common feeling is that one positive news, I think, is that the strain of virus that we have in India, the seeing in India, is of milder strain. So I think that is a positive news. So that is why our recovery rate is very high. If you see, our recovery rate is very remarkably higher than other countries. So that is a good news. But the issue is the density of the population. The population density is so high. Right now, we are only seeing it in few cities. But if once the lockdown is opened up and we see an aggressive intermingling of the people, I think this peak will be delayed. Otherwise, expectation was that this peak should happen by July or August. But in my personal opinion, it should go till September or October, and we will only see the relief post that.
Thank you, Mr. Malhotra, for your valuable insights. We got a lot of good takeaways and cleared air about the healthcare sector in general. We appreciate your time.
Thanks a lot, and we really appreciate the time of all the participants also. And we also again salute the spirit of COVID warriors and the positive work that they are doing across India. Thanks a lot.